enhancing the quality and affordable health care. Mr. Speaker, the Kenya Kwanza administration is committed and determined to realize the constitutional right to health in the shortest time period by delivering a universal health care coverage USA system. This entails promoting access to quality and affordable health care through the Universal Health Care Coverage Program. Towards this end, Mr. Speaker, I propose to the National Assembly to effect budget allocation of Kenya shillings 141.2 billion to the health sector to support various programs aimed at supporting universal health care coverage. Mr. Speaker, specific proposed allocation for the various activities and programs include Kenya shillings 18.4 billion for the universal health care coverage, Kenya shillings 3.7 billion for the Kenya COVID-19 emergency response project, Kenya shillings 4.1 billion for free maternity health care, Kenya shillings 5.9 billion for the managed equipment services, as well as managed equipment services MES, as well as Kenya shillings 1.7 billion to provide medical cover for the elderly and severely disabled persons in our society. Mr. Speaker, to lower cases of HIV/AIDS, malaria and tuberculosis in the economy, Kenya shillings 24.8 billion is proposed at a global fund, and Kenya shillings 4.6 billion to enhance vaccines and immunization program. Mr. Speaker, to promote early diagnosis and management of cancer and reduce the burden of treatment among Kenyans, I propose to the National Assembly to effect a budget allocation of Kenya shillings 1.9 billion for construction of cancer center at Kisii Level 5 Hospital, Kenya shillings 500 for strengthening of cancer center management at Kenyatta National Hospital, and an additional Kenya shillings 155 million is proposed for the establishment of regional cancer centers. Further, to improve the health service delivery, I propose to the National Assembly to effect a budget allocation of 21.6 billion for Kenyatta National Hospital, Kenya shillings 12.8 billion for the Moi Teaching and Referral Hospital, Kenya shillings 8.8 billion for the Kenya Medical Training Colleges, Kenya shillings 3.3 billion for the Kenya Medical Research Institute, Kenya shillings 2.4 billion for the construction of the Kenya National Hospital burns and pediatric centers, Kenya shillings 1.4 billion for the equipping of laboratories and classrooms of KMTC, Kenya shillings 1.1 billion for the renovation of Kenyatta National Hospital, Kenya shillings 1 billion for the procurement of family planning and reproductive health commodities, Kenya shillings 1 billion for the procurement of equipment for the National Blood Transfusion Service, and Kenya shillings 352 million for the digital health platform.